The opioid epidemic is something that we face, feel, and see every single day. But it's important to recognize that there's not a single silver bullet that can be used to solve this problem. But at Regence, there are things that we are doing to make an impact in this space. Hi, my name is Steve Lamb, and I'm a clinical pharmacist with Regence, and today we're here to talk about naloxone. So naloxone is an FDA-approved medication that's used to treat the effects of an opioid overdose. Typically, the way that medication is used is when someone is overdosed on the drug, they're typically unconscious, they have pinpoint pupils, they basically need the medication to survive. The way that you administer that drug is by either giving it intranasally or in the form of an injection. And so there are a lot of different forms of naloxone that are available out in the market. So it's important for you to talk to your doctor or to your pharmacist to see if naloxone is right for you or for your family member. We are making the medication more available this year, so beginning 1/1/2020, we have what is called the naloxone value list. And what the naloxone value list is a way for our members to access this medication either at a $0 cost share, so $0 out of your pocket, or at a reduced cost share. This is really designed for a specific patient or person who needs this drug, and those are typically those who exhibit three key features. People who are at high risk of overdosing on an opioid medication, such as those who are using very high doses of those medications, or it could be a family member who has a family member in their house who's using high doses of medications, of opioids. And the last one could be people who have a history of substance use disorder. So really three different populations out there that could benefit from having naloxone on hand. The three most common signs of opioid overdose is someone who is, one, unconscious, meaning that you can't wake them up. Number two is someone who has pinpoint pupils. So that's typically when you look in their eye and you see that their pupils are really small and narrow. And the last one, which is the hallmark sign, is when they're not breathing. To learn more about what Regence is doing around the opioid epidemic, please visit news.regence.com.